Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification. There is a classification number 34, Anti-Cancer drugs part 1 or Anti-Neoplastic drugs part 1. Now these anti-cancer drugs, you have different classification of anti-cancer drugs. There are a lot of classes of anti-cancer drugs, so we are going to see this classification in the different parts. So today anti-cancer drugs part 1. Now this classification is very important for your upcoming GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 33 classification videos, and if anybody has not seen previous classification videos, please go in the channel's playlist and watch all the classification videos, because they are very important for your upcoming GPAT Niper DI Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these classification videos. In those videos I have not only explained you the classification, but also I have told you some other important points which are really important for you GPAT Niper DI Pharmacist. So please go in the channel's playlist and watch all the previous classification videos. My dear students, before starting the actual classification, you should know certain background about the cancer. You should know what do you mean by cancer. So cancer is nothing but the kind of disease where there is an uncontrolled cell growth, there is an uncontrolled cell proliferation, there is a metastasis, there is invasiveness with the loss of functional capacity of cells. So कैंसर मतलब क्या, आपके खुद के बॉडी के सेल ही अनकंट्रोल तरीके से ग्रो हो जाएंगे, उनका फंक्शन कैपेसिटी लॉस हो जाएगा, वहाँ पे इन्वेजिवनेस रहेगा, वहाँ पे मेटास्टेसिस रहेगा, उसको बोलते हैं कैंसर. और कैंसर इज द वन ऑफ द मोस्ट इंपॉर्टेंट कॉज फॉर थाउजेंड्स ऑफ डेथ in today's date. Now why there is cancer? There are certain reasons behind the cancer. One of the reason is nothing but the genetic reason, genetically mediated cancer also. Another reason is nothing but some virus can cause cancer, like adenovirus. There are certain other reasons like excessive free radical in your body, excessive free radicals in your body. There are certain drugs which can cause cancer known as oncogens or cancer causing agents. So cancer reasons are different. Reasons are, lot of reasons are there behind the cause of cancer. That is not our today's part of our session. Why? Now drugs used in the treatment of cancer, they are known as anti-cancer drugs or anti-neoplastic drugs, and they are not selective in nature. वो selective नहीं होता. So as that of your antibacterial drugs or antibiotics क्या होते हैं कि they are selective in nature. They are selective in nature and they easily target your pathogenic microbial cells, not our own cells. So they kills only pathogenic bacteria, they kills only bacterial cell or infectious cell, and they will not affect the host cell. But in case of cancer, why anti-cancer drugs are non-selective in nature? Anti-cancer drugs selectively cancer cell को नहीं मारेंगे. क्यों नहीं मारेंगे? क्योंकि कैंसर क्या है कि कैंसर इज नथिंग बट द योर ओन सेल, अनकंट्रोल्ड डिफरेंशिएशन ऑफ ओन सेल. आपके खुद के सेल ज्यादा डिवाइड हो रहे हैं, तो आपका खुद का सेल नॉर्मल सेल और कैंसर सेल में डिफरेंस बहुत ही कम होता है. एंड व्हाट इज द डिफरेंस कि नॉर्मल सेल का ग्रोथ नॉर्मली कंट्रोल किया जाता है एंड कैंसरस सेल का ग्रोथ कंट्रोल नहीं किया जाता. सो इट इज अनकंट्रोल्ड ग्रोथ ऑफ सेल, दैट इज कैंसर. सो इन बोथ आर योर ओन बॉडी सेल. दैट्स व्हाई देयर इज अ लिटिल बिट डिफरेंस इन द कैंसरस सेल एंड नॉर्मल होस्ट सेल. ओनली डिफरेंस इज नथिंग बट द मेटाबॉलिज्म. देयर इज अ हायर रेट ऑफ मेटाबॉलिज्म इन द कैंसरस सेल, हायर रेट ऑफ सेल डिवीजन इन द कैंसरस सेल, एंड देयर इज अ लिटिल लेस रेट ऑफ metabolism, less rate of cell division in the normal cell. That is the only difference. But in case of antibacterial drugs, तो बैक्टीरिया एंटीबायोटिक्स में और एंटी कैंसर ड्रग में सिलेक्टिविटी, एंटी कैंसर ड्रग में सिलेक्टिविटी नहीं है, एंटीबायोटिक्स में सिलेक्टिविटी है. क्यों? बिकॉज एंटीबायोटिक्स में क्या होता है कि देयर इज अ सर्टेन डिफरेंस इन योर होस्ट सेल एंड पैथोजेनिक माइक्रोबियल सेल. So there is a difference in the DNA, RNA. There is difference in the various metabolic reactions. There is difference in the various intermediates. There is difference between various enzymes. So that's why antibiotics are very selective in nature. They are very targeted in nature. But anti-cancer drugs, they are not selective in nature. They are not targeted, and that's why most of the anti-cancer drugs, they will cause adverse effect. And what are the common adverse effect? So anti-cancer drugs, they selectively kills cells where there is active cell division. जहाँ पे सेल डिवीजन ज्यादा हो रहा है, जहाँ पे रेट ऑफ सेल डिवीजन ज्यादा है, वहाँ पे एंटी कैंसर ड्रग्स एक्ट करेंगे, राइट. सो आपके नॉर्मल बॉडी सेल में, नॉर्मल बॉडी में भी कुछ सेल्स होते हैं जो डिवाइडेशन होते रहते हैं, एक्टिवली डिवाइडिंग रहते हैं. कौन से? For example, hair follicles. So they are a normal cell. They are actively dividing. So anti-cancer drug kills your cancerous cells also. Along with that they kills your hair cells. So alopecia will be the adverse effect of anti-cancer drug. Again, your bone marrow having actively dividing cells like WC, RBCs, thrombocytes. So anti-cancer drugs kill the cancer cells along with the actively dividing cells like bone marrow. So bone marrow suppression is the adverse effect of your most of the anti-cancer drugs. So that's why they can cause thrombocytopenia, leukopenia, okay, neutropenia. They can cause aplastic anemia. That is again one more toxicity. Another, there are epithelial cells of GIT which are rapidly dividing, which are rapidly multiplying. वो आप पे जो GIT का जो epithelial cells होता है वो actively dividing होता है, and that side has been replacing day by day. तो वो जल्दी जल्दी replace होता है. So anti-cancer drugs can kill cancerous cells along with they will damage the epithelial cells of GIT. So that's why most of the anti-cancer drugs will have adverse effect of GIT irritation, vomiting, nausea, then ulceration, stomatitis. So these are the again adverse effect. Okay. Another cells are there in your body which are rapidly dividing cells. For example, sperm cells. In the testis, there is a formation of sperm cells, spermatogenesis. So this anti-cancer drugs, this suppresses the anti-cancer drugs suppresses the spermatogenesis. They can cause azoospermia. They can cause impotence in the male. They can cause amenorrhea and galactorrhea in the females. That's why they are teratogenic in nature. So anti-cancer drugs, they are having alopecia as adverse effect, bone marrow suppression as adverse effect, GIT, ulceration as adverse effect, nausea, vomiting as adverse effect. Again, they will have depression effect on the spermatogenesis, ovulation, etc. etc. Here, this is the active growth of cell. Okay. So before understanding the classification of anti-cancer drug, you should know normal growth cycle of your cell. Cell आपका growth कैसे होता है? Normal growth cycle of cell or different phase of cell cycle. They are divided into different types. First one is a G0 phase. So in the G0 phase, it is known as a dormant phase or resting phase. तो G0 phase में आपके cells divide नहीं होते. They are in a resting phase. They are in a dormant phase, right? Now, when there is a cell division, this G1 phase is there. G1 phase means it is known as a pre-synthetic phase. G1 phase is known as a pre-synthetic phase. Now, pre-synthetic means what? In the pre-synthetic phase, cell will prepare itself for multiplication. Cell will prepare itself for mitosis. So, for the further process, whatever components are required, so that will be synthesized in the pre-synthetic stage. प्री-सिंथेटिक स्टेज में क्या होगा? जो इंटरमीडिएट लग रहे डीएनए रेप्लिकेशन के लिए, कुछ प्रोटीन सिंथेसिस के लिए, वो सब बनाएंगे प्री-सिंथेटिक फेज, G1 फेज और गैप 1 फेज. Then after that there is a synthesis phase known as a S phase. So there is a synthesis of proteins, nucleic acids, synthesis of DNA, hormones, etc. There is synthesis of enzymes, DNA, nucleic acids, proteins. Now post-synthetic phase. Post-synthetic phase means it is known as a G2 gap. So where there is a modification of whatever is synthesized. जो DNA बना है, जो प्रोटीन बना है, जो enzymes बने हैं, उनके modification होंगे. Post transcriptional modification will be there. There is a post synthetic phase, and after that there is a mitosis. Mitosis means what? There is actual cell division. There is an actual cell division. So in the mitosis, whatever chromosome is synthesized in the synthetic phase. So जो synthesis हो चुका है, जो chromosome बना है, उसका dividation हो जाएगा. And there will be formation of two nucleus, and there will be formation of two cells. That is a daughter cell. Now these daughter cells will either go into a dormant position, or daughter cell will either enter into this cell cycle. Now this is a normal cell cycle. This is increased in case of cancer. That's why most of the anti-cancer drugs, they affect these cycles. Okay. Now those drugs which are affecting the particular phase of cell cycle, जो ड्रग पर्टिकुलर फेज जो है सेल साइकिल का उसको अफेक्ट करते हैं, तो उनको क्या बोलेंगे? उनको बोलेंगे सेल साइकिल स्पेसिफिक ड्रग. सो सेल साइकिल स्पेसिफिक ड्रग. Cell cycle specific drug means some drug they will affect this synthetic phase, some drug will affect this pre-synthetic phase, some drug will affect this post-synthetic phase, some drug will affect the mitotic phase. So depending on that, so if drug is able to affect a particular phase of your cell cycle, they are known as the cell cycle specific drugs. Now cell cycle specific drugs, they are only active in actively dividing cells. जहाँ पे रैपिड डिवीजन हो रहा है सेल्स का, वहाँ पे ये सेल साइकिल स्पेसिफिक ड्रग्स ज़्यादा एक्टिव होंगे, राइट? नाउ देयर आर सर्टेन अदर ड्रग्स नोन एज नॉन सेल साइकिल नॉन स्पेसिफिक ड्रग्स. Cell cycle non-specific drugs. So they are not only effective in the cell cycle, but they are also effective in the dormant phase. ठीक है, जो सेल साइकिल स्पेसिफिक ड्रग है वो सिर्फ एक, जो सेल साइकिल स्पेसिफिक ड्रग है वो सिर्फ एक ही सेल फेज के ऊपर इफेक्टिव रहेंगे. एंड दोज ड्रग विच आर नॉन सेल साइकिल स्पेसिफिक, दे आर इफेक्टिव इन द resting phase as well as this different phase of cell cycle. जो cells cycle non-specific drug, for example this drug, so they are effective in the different phases of cell growth cycle as well as dormant phases when cell is on rest. तो rest में भी cell में resting phase में भी cell को kill करेंगे और dividation phase में भी cell को kill करेंगे. So we'll see that. Now G1 yes phase, those drug which affect on the pre-synthetic phase and synthetic phase. So example, cell cycle specific drug is etoposide, non-cell cycle specific drug is a platinum compounds. Okay, so non-cell cycle specific drug, they will act on a actively dividing cells as well as resting cells, remember. Okay, now those drug which affect the synthetic phase of your cell cycle, so most of the antimetabolite, all antimetabolite will affect the synthetic phase, and they are nothing but the cell cycle specific drugs. Okay, now which are cell cycle non specific drugs which affect the synthetic phase. So alkylating agents, they will affect the synthetic phase and they are known as a cell cycle non specific drug. Now what are the examples of drugs which affect the G2 and EM phase, means post synthetic phase and mitosis. So in the cell cycle specific drug, you have examples of your bleomycin and etoposide. In the cell cycle non-specific drug, you have example of anthracyclines and dactinomycin. Now, what are the examples of drug that affect the EM phase, mitosis phase of cell cycle? So in that cell cycle specific drugs are nothing but the vinca-alkaloids, taxanes, then zabipirone and istramastine. Now cell cycle non-specific drug, for example, in that you have mitomycin and camptothecin. So these are the drug. You have to remember this classification. Cell cycle effect of anti-cancer drug. So certain drugs, they affect the particular cell cycle of your cell growth cycle. So they are known as cell cycle specific drug. They are only active against the actively dividing cells. वो actively dividing cells में ही effective रहेंगे. And those which are known as a cell cycle non-specific drug, they are actively in the both stages. In the resting phase, that is so जो cell cycle non-specific drug है वो ये G1 G2 and M इसमें भी एक्टिव रहेंगे, and जो resting phase है G0 उसमें भी एक्टिव रहेंगे. And that's why cell cycle non-specific drug, they are having more adverse effect. Okay, we'll see the classification of this anti-cancer drug again. I will explain here different phase of cell cycle and different kind of drug which are acting on a different phase of cell cycle. So G0 phase, first one is nothing but the G0 phase. So G0 phase is now known as a resting phase or dormant phase. Now G1 phase is known as a synthetic phase or pre-synthetic phase. G1 phase is known as a pre-synthetic phase. So where cell will synthesize raw material required for the synthetic phase or enzymes required for the synthetic phase. In the G0 phase and G1 phase, these alkylating agents, they are known as non-cell cycle specific drug, like alkylating agent like cyclophosphamide, cisplatin and procarbazine. Anti-tumor antibiotics like doxorubicin, daunorubicin, they also act on a G0 phase. Okay, G0 phase plus your cell cycle phase. Again, nitrosourea, they also act on a, they are known as a non-cell cycle specific drug. So these drug, alkylating agent, anti-tumor antibiotics, nitrosourea, they will act on a resting cell cycle phase as well as actively dividing cells. Now, what are the drugs which are affecting on the synthetic phase? So in the synthetic phase, your cell will start synthesizing the DNA, will start synthesizing the enzymes, will start synthesizing the proteins. So in that stage, these drugs, yes, phase specific drugs, like these drugs will act. So cytarabine is there. Cytarabine, it is a arabinoside antibiotic. Cytosine arabinoside, it is a cytosine cytosine arabinocyte, that is citrabine. Then 6 mercaptopurine, it is a purine analog. 6 thioguanine purine analog. 5 fluorouracil, it is a pyrimidine analog. Methotrexate is anti-metabolite. Hydroxyurea is a again alkylating agent. And this they are irinotecan and etoposide. They are natural compound. They are known as topoisomerase 1 and 2 inhibitor. Now, what are the examples of drug which act on a EM phase, that is mitotic phase? Mostly and again natural and anti-cancer drug like vincristine, vinblastine. They are known as vinca alkaloids. They affect the microtubule function. They are known as spindle poison. जो vincristine, vinblastine होता है उनको spindle poison बोलते हैं. They arrest the cell mitosis. They prevent the cell mitosis. So they block the tubular polymerization of spindle. Then paclitaxel is there, which also block the depolymerization of microtubule. So they are known as the spindle poison. Okay, and drug which affect on a G2 phase. G2 phase is known as a post-synthetic phase or post-synthetic modification. So bleomycin will act on a post-synthetic mode. So these are the nothing but the examples of drug which are cell cycle non-specific drug and cell cycle specific drug. सेल साइकिल नॉन स्पेसिफिक ड्रग कौन से अल्कलाइटिंग एजेंट है, एंटीट्यूमर एंटीबायोटिक्स, नाइट्रोसोलियर. सेल साइकिल स्पेसिफिक ड्रग मतलब वो पर्टिकुलर फेज के ऊपर एक्टिव होंगे. ठीक है, जैसे G1 फेज, S फेज, G2 फेज, M फेज. ओके, सो वी विल सी द क्लासिफिकेशन अगेन वंस. सो एंटी कैंसर ड्रग्स और साइटोटॉक्सिक ड्रग. एंटी कैंसर ड्रग्स और साइटोटॉक्सिक ड्रग. सो एज आई टोल्ड यू वी आर गोइंग टू सी दिस क्लासिफिकेशन इन डिफरेंट पार्ट. सो साइटोटॉक्सिक ड्रग पार्ट 1. सो इन दैट यू हैव 6 क्लासेस. In the cytotoxic drug part 1 you have 6 words. इसमें 6 classes होंगे. So we are going to see 3 classes today. So first class is nothing but the alkylating agents. First class is nothing but the alkylating agent. Second class is nothing but the platinum compounds. Third class is nothing but the anti-metabolite. So this cytotoxic drug classification, in the cytotoxic drug you have 6 classes of cytotoxic drugs. So along in that 6 classes, so we are going to see 3 classes. So first class is nothing but the alkylating agent. So first class is nothing but the alkylating agent. Second class is nothing but the platinum coordinate complex or platinum compound simply. And third class is nothing but the anti-metabolites. So first class alkylating agent. तो alkylating agent क्या करेंगे? Alkylating agent will cause alkalization of different nucleosides of the RNA, DNA. Okay. So जो DNA है, in that you have nucleosides. So alkylating agents, they will cause alkylation, they will cause methylation, they will cause ethylation of by generating the free radicals, and that free radical will combine with the particular base pair in the DNA and will cause dimerization and will cause disturbance in the structure of DNA. So alkylating agents, they will cause alkylation of nucleic acid bases, particularly pyrimidine base, right? So one of the most important site for alkylating agent is nothing but the N7 of guanosine. So nitrogen 7 of guanosine. So that is one of the important site for this alkylating agent. So in that you have first class alkylating agent में पहला class कौन सा है? Okay, nitrogen mustard. In that you have meclorethamine, cyclophosphamide, phosphomide, chlorambucil and melphalan. So you can remember this by one trick known as a मेरी साइकिल EMIC कंपनी की है. मेरी साइकिल ओके MINC मेरी EMIC साइकिल. सो या फिर मेरी साइकिल EMIC कंपनी की है. सो मे मतलब मेक्लोरेथामाइन, साइकिल मतलब साइक्लोफॉस्फामाइड, आई मतलब फॉस्फामाइड, क्लोरम्ब्यूसिल फॉर सी एंड M फॉर मेल्फालान. सो मेरी साइकिल EMIC. नाउ मेक्लोरेथामाइन, cyclophosphamide, meclorethamine is a vesicant. It has an adverse effect of vesication. So ये आपके ब्लड वेसल में परमेबिलिटी बढ़ा देगा, आपका इन्फ्लेमेशन करेगा, पेन करेगा, वहाँ पे टिंगलिंग कर सकता है. Cyclophosphamide along with the common adverse effect, cyclophosphamide has one important adverse effect known as a hemorrhagic cystitis. So that is treated by using mesna. अगर है hemorrhagic cystitis तो mesna उसका एंटीडोट है. Now this cyclophosphamide is a prodrug. It is converted into active metabolite known as aldophosphamide, and also during the metabolism there is generation of one toxic metabolite known as acrolein. Acrolein is the metabolite of cyclophosphamide, and that causes the hemorrhagic cystitis. And in case of hemorrhagic cystitis caused by cyclophosphamide, the drug is used is mesna. That is nothing but the mercaptoethane sodium sulfonate. Mercaptoethane sodium sulfonate. That is mesna. No? Cyclophosphamide and is phosphomide, or cyclophosphamide and phosphomide. Both these drug causes the same adverse effect. Out of that also, phosphomide is having higher toxicity like neurotoxicity, ototoxicity, hemorrhagic cystitis, along with the neurotoxicity and hematotoxicity. Okay, both these. Then chlorambucil is there and melphalan is there. Okay. Now in the alkylating agent itself, you have second class known as ethylene imine. Ethylene imine में आता है thiotepa. Okay. And third class in the alkylating agent, alkyl sulfonate. Example is a busulfan. So this is a very lipid soluble drug. ये lipid soluble होता है, easily can cross the blood-brain barrier, and that's why it is used in the brain tumors, particularly known as the glial tumors. So busulfan is used in the glial tumors. Now nitrous urea, in that you have in the alkylating agent, the fourth class is nothing but the nitrous urea. Fourth class is nothing but the nitrous urea. In that you have carmustine and lomustine. Carmustine and lomustine. Fifth class in the alkylating agent is nothing but the triazine. In that you have dicarbazine and temozolomide. Temozolomide. Dicarbazine and temozolomide. Last class in the alkylating agent you have methyl hydrazine derivative. उसमें आएगा procarbazine. So procarbazine is not a true alkylating agent. So it is not an alkylating agent. It prevents the synthesis of DNA in a different mechanism. So you cannot call procarbazine as a true alkylating agent, right? Now in the cytotoxic drug, second class is nothing but the platinum compound. Platinum compounds. In that you have cisplatin, carboplatin, and oxaliplatin. Cisplatin, carboplatin, and oxaliplatin. So all these are the platinum compound. They have same mechanism of action as that of the alkylating agent. ये भी क्या करेंगे? Instead of doing alkylation, they will cause their platinum radical will bind to the DNA and will cause dimerization of DNA. Cisplatin, carboplatin, oxalate. Now these drugs have the one adverse effect. They are known as they are having nephrotoxicity in addition to the other adverse effect. जो बाकी adverse effect होता है common bone marrow suppression उसके. So in addition to that, this cisplatin is having nephrotoxicity. Nephrotoxicity caused by cisplatin can be treated with the one drug known as amifostine. So amifostine is a drug which is used in the treatment of cisplatin caused nephrotoxicity. Now in the cytotoxic drug, third class is nothing but the antimetabolic, and in that also you have three classes. So first one is nothing but the folate antagonist. So folic acid antagonist, उसमें आएगा methotrexate and pemetrexate. So what is methotrexate? Methotrexate is a folic acid antagonist. It inhibits the dihydrofolate reductase enzyme 1. Also it inhibits the thymidine synthetase, which is required for purine synthesis in the nucleic acid. Again, so synthesis of purine will not be there. That is a methotrexate. Pemetrexate is also same drug related to methotrexate. Now methotrexate has a adverse effect like bone marrow suppression to prevent the methotrexate toxicity to the normal cell. तो ये फॉलिक एसिड एंटागोनिस्ट है, फॉलिक एसिड का सिंथेसिस नहीं होने देगा, तो सेल को फॉलिक एसिड नहीं मिलेगा, आपके नॉर्मल सेल मिलेंगे. सो इन केस ऑफ methotrexate overdose, so you have to use to prevent the toxicity to the normal cell, you have to use leucovorin cytoverum factor or n-10-formyl folic acid. N-10-formyl folic acid, that is known as a leucovorin rescue. Leucovorin rescue. Okay. Then again, next class in the antimetabolite is nothing but the purine antagonist. So in that you have 6 mercaptopurine, 6 thioguanine, azothiopurin, fludarabine. So all these drugs, they are a prodrug. They are activated in the cell. ये सेल के अंदर जाने के बाद एक्टिवेशन होता है उनका, their ट्राइफॉस्फेट डेरिवेटिव उनका बन जाता है. That ट्राइफॉस्फेट डेरिवेटिव binds the purine bases in the nucleic acid and prevent the faulty synthesis of DNA, which is then useless. Now cell will die. Okay, cell will undergo apoptosis. So purine antagonist, 6 mercaptopurine, 6 thioguanine, azothiopurin, fludarabine. Okay. Now next in the antimetabolite, that is a pyrimidine antagonist. In that you have 5-fluorouracil, capecitabine, and cytarabine. So this capecitabine is nothing but it is a prodrug of 5-fluorouracil. Capecitabine is a prodrug of 5-fluorouracil. It is given by oral route. Now we'll see the another important point from this anti-cancer drugs. So alkylating agent, in that you have first nitrogen mustard. Nitrogen mustard में कौन होता है आपका? So in the nitrogen mustard you have meclorethamine, cyclophosphamide, ephosphamide, melphalan and chlorambucil. In the ethylene diamine you have example of thiotepa, hexamethyl melamine. Then alkyl sulfonate, in that you have example of busulfan. In the nitrosourea you have example of carmustine, lomustine and streptozocin. So this streptozocin is an antibiotic obtained from streptococci. It is an antibiotic obtained from streptococci. Then triazine, in that you have procarbazine, dicarbazine, temozolomide. And platinum compound, in that you have cisplatin, carboplatin, oxaplatin. Now another next एंटीमेटाबोलाइट में क्या आएगा? देखो फर्स्ट क्लास आएगा आपका अल्कलाइटिंग एजेंट, प्लैटिनम कंपाउंड, एंड थर्ड क्लास आएगा आपका एंटीमेटाबोलाइट. इन द थर्ड क्लास यू हैव थ्री क्लासेस: pyrimidine analog, 5-fluorouracil, cytarabine and gemcitabine. Then purine analog, in that 6 marker of purine, thiogonine and pentostatin, cladribine. Now folic acid antagonist, in that you have methotrexate, pemetrexate. In natural compound जो है we will see in the next part. But natural compounds में आएगा आपको first vinca alkaloids, vincristine, vinblastine and vinorelbine. Taxanes में आएगा paclitaxel and docetaxel. Etopodophyllotoxins, in that you have etoposide, teniposide, campothecans, topotecan and irinotecan. Anti-tumor antibiotics, in that you have anthracycline derivative like doxorubicin, daunorubicin, epirubicin, idarubicin. Now anti-cancer antibiotics, they are having cardiotoxicity. ये सबको क्या है? Cardiotoxicity है. In addition to other common adverse effect of anti-cancer drug. बाकी जो common adverse effect, in addition to that, उनके साथ में cardiotoxicity भी है. Daunorubicin, doxorubicin. Okay. Bleomycin, dactinomycin, mitomycin C. Enzymes, that is L-asparginase. Now we will see distinctive adverse effect of each and every drug. Adverse effect of or toxicity of alkylating agent. Distinctive toxicity of alkylating agent. So cyclophosphamide has an adverse effect of this: alopecia, hemorrhagic cystitis, serum inappropriate ADH secretion, syndrome inappropriate ADH secretion, syndrome inappropriate aldosterone secretion. So जो cyclophosphamide होता है, that can cause alopecia. Alopecia means loss of hair. Hemorrhagic cystitis. In case of hemorrhagic cystitis, now it is caused by one of the toxic metabolites produced by cyclophosphamide, that is known as acryloin. Cyclophosphamide is a prodrug. It is converted into aldophosphamide, and that is metabolized. One of the metabolite is acryloin. That acryloin causes hemorrhagic cystitis. To prevent that, there is one drug known as a mesna. Okay, marcaptoethane, sodium salt of sulfuric acid, that is a mesna. So mesna is the compound used in the treatment of hemorrhagic cystitis caused by cyclophosphamide. Remember, now isophosphamide also can cause hemorrhagic cystitis and syndrome inappropriate aldosterone secretion. Again mesna is used. Then busulfan, it can cause pulmonary fibrosis, hyperpigmentation and adrenal insufficiency. Procarbazine can cause secondary leukemia. So every cancer, anti-cancer drug can cause cancer. तो आप बोलेंगे सर ये कॉन्ट्रडिक्शन है लेकिन हाँ और हर एक एंटी-कैंसर ड्रग जो होता है वो कैंसर भी कर सकता है. They are also carcinogenic. So procarbazine causes secondary leukemia. So that is another disulfiram like reactions in the alcohol. Behavioral toxicity, CNS depression. Cisplatin, okay, it is a platinum compound. It can cause emesis, nephrotoxicity, peripheral sensory neuropathy, ototoxicity. तो emesis जो cisplatin होता है, that is the most emetic in nature amongst all anti-cancer drug. जितने भी anti-cancer drug है उसमें से सबसे ज़्यादा emetic कौन है? Cisplatin. And it can also cause nephrotoxicity. Now nephrotoxicity caused by cisplatin can be prevented by or can be treated by amiprostine. Amiprostine is a drug which is used in the treatment of nephrotoxicity caused by this cisplatin. Now we'll see the adverse effect of antimetabolites. Adverse effect of antimetabolites. So distinctive toxicity of antimetabolites. तो उसमें फर्स्ट है आपका 6 markaptopurine and 6 thiogonine. So they have hepatotoxicity as an adverse effect. Hepatotoxicity as an adverse effect. In addition to the other adverse effect like bone marrow suppression वगैरह जो है बाकी anti-cancer drug के common adverse effect bone marrow suppression, leukopenia like that, alopecia. In addition to that, 6 markaptopurine and 6 thiogonine they are hepatotoxic in nature. Now methotrexate it causes the mucositis and hepatotoxicity. 5-fluorouracil can cause hand and foot syndrome. ये क्या करके hand and foot syndrome. इसमें क्या होता है? In that your hands and foots there is a inflammation, there is a edema, there is a tingling sensation in the hands and foot. That is a 5-fluorouracil. Also can cause neurotoxicity. Capecitabine it can cause again hand and foot syndrome, hyperbilirubinemia. Cytarabine or cytosine arabinocyte it can cause cerebellar ataxia. Fludarabine can cause arthralgia and gemcitabine can cause diarrhea. So these are the distinctive adverse effects or distinctive toxicities of antimetabolites. We will see again in a very short revision of these drugs. So first drug is nothing but the cyclophosphamide. What is the mechanism? It causes the alkalization of it is alkylating agent because it attacks the N7 guanine group and causes dysfunctional DNA. What are the uses of cyclophosphamide? It is used in the working disease, ovarian cancer, breast cancer, and neuroblastoma. What is the adverse effect? Bone marrow suppression. BMS means bone marrow suppression. Hemorrhagic cystitis. Hemorrhagic cystitis is caused by acryloin metabolite, which is produced by mesna. Now, cisplatin is again alkylating agent. It causes the cross-linking of DNA strand, platinum dimer formation. It is used in the testicular cancer, ovarian cancer, bladder cancer. Toxicity क्या है? Adverse effect nephrotoxicity, which can be removed by amipostin. It also causes neurotoxicity, leads to deafness, ototoxicity. Now next drug is the procarbazine. It is also alkylating agent used in the working disease, and it causes the bone marrow suppression and it can causes secondary leukemia. Right? Now next drug is nothing but the doxorubicin. Doxorubicin is a anti-cancer antibiotic. It acts via it is intracatheter. It will form a free radical, inhibit the topoisomerase enzyme. It can be used in the Hodgkin's disease, breast cancer, endometrial lungs, and ovarian cancer. So again, adverse effect bone marrow suppression, and delayed conjunctival failure. Methotrexate is the next drug known as a antimetabolite. So it is a cell cycle specific drug. It is a folic acid synthesis inhibitor. 5 dietropholate inhibitor. It will act on a space. It is used in the leukemia, lymphomas, breast cancer, rheumatoid arthritis, psoriasis. Again, adverse effect is nothing but the bone marrow suppression. To prevent the cell toxicity, leucovorin is used. Folic acid is used to reduce the toxicity of methotrexate. Now next is a 5-fluorouracil and capecitabine. Capecitabine क्या है? Capecitabine is a prodrug of 5-fluorouracil. They are known as a thymidine antimetabolite. They are often on a S phase, so they are activated in the cell by the thymidine. They are activated in the cell by the enzyme, and they inhibit thymidate synthase enzyme. So they are used in the breast cancer, ovarian cancer, neck cancer, topical and basal cell cancer, keratosis, colorectal cancer. There are also bone marrow suppressant. 6 markaptopurine is again a antimetabolite. ये भी क्या है? Antimetabolite. So it is a purine antimetabolite. It is also activated by this GPR enzyme. Hypoxanthine, guanosine, phosphoribosyl reductase transferase enzyme. So 6 markaptopurine is a cell specific cycle drug. It is activated by this enzyme and inhibit the DNA synthesis. Now it is used in the acute lymphocytic leukemia. It is used in the both acute myeloid leukemia and acute chronic myeloid leukemia. It is an immunosuppressant. Also it causes the bone marrow depression. Now next drug is the bleomycin. Bleomycin क्या करता है? It form a complex with the ferrous and oxygen, which radically generated and DNA strand that damage the DNA strand. That's called the DNA strand scission. Used in the organ and testicular, head, neck, skin cancer. It can cause pneumonitis, pulmonary fibrosis. It can cause pneumonitis, pulmonary fibrosis. नेक्स्ट आता है आपका विनक्रिस्टिन विनक्रिस्टिन विनका अल्कलाइड्स they are known as spindle poison. They inhibit the microtubule polymerization, inhibit the mitosis. They are used in the Hodgkin's disease, testicular cancer, Kaposi cancer. They have a bone marrow suppression and neurotoxicity as well. Now all trans-retinoic acid, it is used in the, it is a differentiating agent, promotes the differentiation of promyelocytes used in the acute myelogenous leukemia. It can cause differentiation syndrome with the respiratory depression, pleural and peripheral effusion. They are the symptoms. We'll see the important points from this anti-cancer drugs. So first is nothing but the log kill hypothesis. Log kill hypothesis मतलब क्या? So all anti-cancer drugs they are a cytotoxic drug. Okay, they follow the first order kinetics. That means a constant proportion of cancerous cell will be killed. So they can kill constant proportion of cancerous cells. That is constant percentage of cancerous cell rather than number of cells. So that is nothing but known as a log kill hypothesis. Means for example, a particular dose is required to reduce the cancer cell population from 1000 cells to 100 cells. Say for example 10 milligram anti-cancer drug लग रहा है आपको 1000 सेल से 100 सेल्स तक लाने के लिए, मतलब उतना प्रोपोर्शन किल करने के लिए, तो उतना ही डोज आपका 100 सेल से 10 सेल तक किल करेगा. They are a concentration, they are a percentage. Okay, they kills the cancer cell in a constant proportion. They follow the first order kinetics. You have to remember. That is known as the log kill hypothesis. Now remember, cyclophosphamide is a drug of choice in the beginner's granulomatosis. Cyclophosphamide is a drug of choice in a beginner's granulomatosis. Again, you have to remember next point. Meclorethamine is used in the Hodgkin's disease and it's the most powerful vesicant. ये क्या करेंगे? ब्लड वेसल को परमेबिलिटी बढ़ा देंगे, वहाँ पे इन्फ्लेमेशन कर देंगे, पेन कर देंगे. Now next is nothing but melphalan is a drug of choice in case of multiple myeloma. You have to remember, melphalan is a drug of choice in the multiple myeloma. Next one is nothing but the streptozotocin. It is a drug used in the pancreatic cancer. ये particularly it is selectively acting on a islet cell tumor used in the pancreatic tumors. Platinum complex compound जो होते हैं, so they are having most common adverse effect known as nausea and vomiting. They will irritate your GIT and can cause nausea and vomiting, and they are the most prone drug amongst all anti-cancer drugs. जितने भी anti-cancer drug है उसमें से सबसे ज़्यादा nausea और vomiting कौन कर रहा है? Platinum compounds. Okay, they can also cause, so out of that, cisplatin can cause nephrotoxicity, ototoxicity, and neurotoxicity, and they can decrease all ions from the serum. जैसे सोडियम आयन कम कर देगा, पोटेशियम कम कर देगा, कैल्शियम कम कर देगा, फॉस्फेट कम कर देगा. So hyponatremia, hypokalemia, hypophosphatemia, hypocalcemia, right? Then oxaliplatin is hematotoxic. Oxaliplatin को nephrotoxicity और toxicity कम है, neurotoxicity कम है, लेकिन hematotoxic है. So in case of nephrotoxicity caused by cisplatin, amitriptyline is a drug which is used to prevent the nephrotoxicity caused by cisplatin, amitriptyline. You have to remember. Now to prevent the methotrexate toxicity, this folinic acid, N10 formyl tetrahydroforic acid, that is known as a leucovorin cytotoxin factor, which is used. It is known as a leucovorin rescue. Or in case of severe toxicity, ज़्यादा toxicity हो गया methotrexate का, तो there is one drug known as a glucocerebrosidase. There is known as a glucocerebrosidase. This is a methotrexate inactivating enzyme, or it is a methotrexate cleaving enzyme that is also used. So there are two antidotes for methotrexate. First is a folinic acid, that is a leucovorin, known as a leucovorin rescue, and glucocerebrosidase. Gemcitabine is a drug of choice in a prostate cancer. You have to remember. Gemcitabine is a drug of choice in a prostate cancer. Fludarabine is a drug of choice in the chronic lymphatic leukemia. Cladribine is a drug of choice in a hairy cell leukemia. Fludarabine is a drug of choice in case of chronic lymphatic leukemia. Cladribine is a drug of choice in case of hairy cell leukemia. These are the very important points from the anti-cancer drug. You can order this magic bullet for GPAT Niper DI Pharmacist. Read twice and qualify 100%. You can contact me on this number. You can see we have very much promising result. Thousands of students they are qualified. The GPAT and Niper they are placed in the Niper. You can also join our GPAT Niper online crash course where you will have live lectures, recorded lectures, study material in the form of hard copy and test series. Everything is there in 8,000 rupees only, and that is valid for 2 years, 3 years, 4 years, or you can say it is a lifetime validity, right? And if you get all in rank below 20, your fees will be written in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100.